Right. Hello and good morning. Good morning, everyone. Thank you for joining us for our educational program. All participant lines have been muted to ensure the audio quality and provide a distraction-free learning environment. At the end of the presentation, we will allow for a live short Q&A, and you can use the comment section to send any questions, and we will address as many questions as time allows. At the end of this program, we will send you an evaluation. We ask that you please provide us feedback to ensure that we best serve the lupus community and provide engaging future programming. This is the second session of Navigating the Pediatric Lupus Journey. Each session attended, the pediatric patient will earn a reward. A $5 e-Target gift card will be awarded for each session. At the completion of the webinar series, any rewards earned will be distributed to the pediatric patient. After the completion of all 4 sessions, the pediatric patient will receive 1 electronic gift card and a certificate of completion after completing all 4 sessions, okay? So I would like to take a moment to read a brief disclaimer. The Lupus Foundation of America, Greater Ohio chapter does not give medical advice to patients regarding their lupus treatment. Your physician is the best medical advice to give to your patients, Your physician is the best source of information regarding your medical management of your lupus. This program is available for informational and educational purposes only. The content provided by other providers and/or professionals within the context of this program is not necessarily the opinion of the Lupus Foundation of America, Greater Ohio. So with that taken care of, we can now begin the Navigating the Pediatric Lupus Journey program. Thank you again for joining. My name is Leslie Viscara-Tierney. I have been dedicated to the Lupus Foundation of America Greater Ohio chapter for some time. I actually started off with this chapter as a student in high school and have grown very passionate about the cause. And I thank you for joining us this morning and for taking the time to learn more. We are looking to reconnect in person in the near future, but right now, projects are being carefully considered, and we're hopeful that we can join together real soon. For the time being, we look to the right side of digital programming, and we can now learn from the experts and professionals from across our state at the comfort of your own home. Today, our expert panel has created presentations specifically designed to help you better understand lupus and provide best practices for managing your chronic illness. We have an excellent program this morning. And before we get started, I'd first like to just take another brief moment to recognize our generous sponsor. Funding for this program has been made possible by GSK and Us and Lupus. We would not be able to host these important programs like this without their sponsorship. So thank you to GSK and Us and Lupus for your support. And that brings us to our first presenter this morning. Our first speaker is Dr. Hulya Bukulmez. She's the Director of Pediatric Rheumatology and Pediatric Bone Health Programs within Metro Health Medical Center in Cleveland, Ohio. The topic today she will cover is, we're going to dig into the details of your lupus journey, infection prevention in a COVID-19 world. And if you give me just a moment, Doctor, I will send you the presenter. Thank you for joining us this morning. And you should be able to grab it now.
Okay, can you see my screen? All right,
Yes,
good morning, everybody. And thank you for being here to listen to this presentation. If you have any questions, I'll be happy to answer them in the end. So as Leslie introduced, we are going to talk about infection prevention. I'll talk to you about COVID-19 world as well. You know, what's going on in COVID-19 world and how is it in pediatric infection, as a pediatric infection, and how does it present in lupus patients, and how do we prevent and how do we treat when we have this disease. And of course, last but not the least topic is the importance of COVID-19 vaccination. we'll be talking about vaccination in general in lupus as well. So I picked this picture from Google because I liked it. Apparently, lupus means wolf, and there is a Saturn constellation that is visible between the two constellations, Scorpius and Centaurus, and they are represented by the figure. The lupus is represented by the figure in the middle right here, and apparently Centaurus, this guy here, half horse, half man, is sacrificing the lupus. So I thought that's kind of a nice and neat thing to know. We would like to get rid of the lupus as well. What is lupus disease? So systemic lupus erythematosus is a very chronic disease, and it's an autoimmune disorder in which your body attacks itself. The body's immune system is triggered so hard that it's attacking to itself. And there is very unpredictable disease flares, and sometimes there is also disease remissions that are unpredictable. There is 4 major kinds. The most common one is the systemic lupus erythematosus, which might involve your heart, lungs, kidneys, and brain. The other one is the cutaneous lupus, which might be completely limited to lupus throughout your life. And we also have a drug-induced lupus. After use of certain medications, you might have a lupus-like disease, which goes away once you stop the drugs. There's also neonatal lupus, in which we see in infants of the mothers with lupus with particular autoantibody abnormality. So again, this is multi-system inflammatory disease, and it can damage, if it's untreated, multiple organs. And the most important organs here I circled are the neurological system, so central nervous system, your brain, your blood, so it might cause anemia, it might cause thrombocytopenia, cause bleeding disorders, or it might cause kidney abnormalities and renal failure sometimes. Current standards of care are limited to the immune suppressive medications. So these are corticosteroids, chemotherapy, which might be rituximab, Benlysta, and combinations of these. I don't have the entire list here, but variety of other medications can be used for suppressing the immune system so it doesn't attack itself. So current models of lupus onset is still very complex. There is a lot of theory out there for why this is starting and in which population it's starting and what can we be doing to prevent it. Obviously, there is huge amount of genetic influence. So if you have family members with other autoimmune diseases or lupus, your risk of having lupus is increased, but it's not enough. Genetics, and then you might also need to have a susceptible stage, so in which you have abnormal hormones during puberty, for example, your hormones are not normalized yet. You might have an infection, which we'll talk about more. You might have viral infection, bacterial infection, or simply you might have a sunburn or chronic UV light exposure or some toxins. Again, the list goes on. There are medications here too. Then what happens is your immune system stops being tolerant to all these abnormalities and switches on and starts attacking to itself, which we define as autoimmunity, meaning your immune system is attacking to itself. And then what happens is these dangerous interferon, TNF-alpha, IL-6 type of cytokines are secreted. And there's some epigenetic changes, which is not your genes only, but the genes that are kind of modulating your genes, epigenes, can be also changed for life. And then the tissue damage starts. So during the initial phase, obviously, all these things do not start attacking you, or the loss of tolerance doesn't start. In the first genetic susceptible A stage era, you're completely asymptomatic. However, once the autoimmunity starts, you start developing autoantibodies. ANA is the most famous one, and then you start having symptoms. Multiple inflammatory pathways and cells are affected in lupus. So you see there's multiple things. Almost all the cells out there, complement system, again, epigenetics is here, some genetic interferon diseases, and all these cells were studied one by one in multiple hundreds of studies and were found to be giving susceptibility to the onset of systemic lupus erythematosus. And because of this, the treatment is kind of complex. And all these cells in your system are also the cells that are fighting against any infection that you may face. So if they are not working, then they are not doing a good job to fight against infections. So by nature, lupus patients are immune compromised when their lupus is active. On top of that, we have some treatments to suppress, for example, the B cells. So we use belimumab and rituximab to delete the B cell activation. Imagine that when you block the B cell activation, you also affect the other cells that B cells are affecting. So you're more immune compromised. You might also stop the interferon activation, which is helpful for us to fight against viral infections. Although the others are intact, these medications might cause some interference with our immune functions. So let's talk about lupus flare. By definition, flare in a disease is increase in disease activity in one or more organ systems. So this could be some ongoing clinical signs and symptoms getting worse, or some laboratory measurements can be worsened. It may or may not be clinically significant, so it needs to be checked, but usually a physician can determine how significant it is, or sometimes some lupus researchers are very well trained to do this. If you have the onset of a new symptom or the worsening of the ones that you already experience regularly, then you might be having a flare. So this is very important to notice so that you start taking care of it. What are the flare symptoms? Obviously fever. And then your joint pains or joints might be swollen. They might get more stiff in the morning. You might have hair loss, chest pains. You might start having numbness and tingling and burning pain. You might start having worsening of the rash or a new rash. Fatigue is a very common thing when you have a flare. Sores, ulcers in the mouth or in the nose. Swelling in the legs, not just particularly on the joints, but the entire leg might be swollen, fluid retention, or sometimes it may not give you any symptoms. So what should alarm us for the flare-up? First rule is the symptoms you had when you were first diagnosed with systemic lupus. They will often repeat during the flare. You're going to go back to square one. Second, lupus problems or symptoms that occurred after your diagnosis of lupus. I mean, in the beginning, you may not have all these, and you might have later on. They might go back into remission, and then you might start having them again. A new symptom also could be due to something else, and that needs to be assessed by a physician. What are the causes of lupus flare? Why should you be getting this flare all of a sudden? The most important one to me is the emotional stress, especially since we are talking about pediatric lupus here. Their environmental stressors are issues. I see a lot of patients whose parents are going through divorce. There's a lot of family battle, death in the family, or other life complications. They move from one country to the other country, or they lose their secure environment somehow. Physical stress is also important. And I'm talking about a huge impact, such as a big surgery or physical harm, car accident, and being hospitalized for weeks. Pregnancy or giving birth, which can be complicated. And infections, obviously, I'm going to talk about that a little more. Colds and viral infections in particular, and COVID-19 lately, can induce lupus flare because it's attacking your immune system and your immune system is not able to fight against them. Cigarette smoking has been a major lupus flare factor. Hopefully this is not an issue for kids, but again, kids can be secondary smokers due to their family members smoking. Excessive fatigue due to an activity or exhaustion can trigger this. UV lights are very important, so one of the golden rules in lupus patients is to apply sunblock lotions every 4 to 5 hours. Low vitamin D has been linked with a flare-up, injury again, and most importantly, not being compliant with your medications can be the simple reason for your lupus flare. There are also other debates about some dietary supplements like alfalfa sprouts or mung bean sprouts echinacea herbal supplements, or sulfa antibiotics, this is bacterium simply, trimethoprim sulfamethoxazole, may cause lupus flare, and they are suggested, and you need to kind of be careful when you're picking those. Can vaccinations cause lupus? This is another question that I keep getting from my patients. How vaccines work is important to know before we answer that question. So vaccines mimic the pathogens, thus we become immune to them, but they are not necessarily pathogens themselves. They are immunogenic, they are not infectious. So in the meantime, when we get them, we don't necessarily get sick from that particular infection. There are two kinds. There's a live attenuated vaccines. So these can be actual infections, but they are extremely weak, but they are not dead. And they mimic the real infection. And these are ancient infections, ancient vaccines usually. The most famous ones are MMR and varicella vaccines. And they should be avoided during chemotherapy because the patients might actually get sick. The second ones are much safer. These are the inactivated ones. They are inactive for dead viruses. They are safe. They make people less sick. And the examples are polio, Salk, influenza. And they can be given anytime during illness or chemotherapy. So lupus patients are vulnerable to infections. So we have to be careful when we debate the vaccines with our patients usually. And it's a complex question. For every single vaccine out there, there's some recommendations. And CDC warns to wait at least 4 weeks before starting immunosuppressive after giving a live attenuated vaccine. That's the golden rule that is applicable not only to lupus patients, but also to the other immune compromised patients. Most famous infections that are dangerous in lupus are herpes zoster, which may cause shingles or increase lupus activity, or just cause, which means flare. It's contraindicated. Measles, mumps, rubella, or combinations of measles, mumps, rubella with varicella vaccine are also contraindicated. But there are vaccines required in lupus treatment just because they are more vulnerable to the infections. Pneumococcal infections, tetanus, diphtheria, acellular pertussis, these are all common vaccines that we should be vaccinated for. Hepatitis B virus, influenza infection, influenza vaccine is yearly available, and Haemophilus influenza. Lupus patients are also susceptible to development of cancers just because their immune system is compromised. So it is important to receive some of the particular vaccinations in the lupus patient populations. And these are human papillomavirus, especially in teens, and hepatitis B virus. These vaccines have been proven to prevent cancer, and lupus patients particularly need to be vaccinated for these. So what are other things that we should consider? First of all, every patient needs to keep their vaccine records, and sometimes we check their antibodies to see whether they actually benefited from those vaccines. If there are records of them, they should keep them on their record. Annual flu vaccination has to be done. It doesn't remain the following year. The infection changes, so the vaccine changes too. And if there is allergies to vaccine, we have to be careful. So far, particularly for the influenza vaccine, there's no virus in the vaccine anymore. However, if you developed Guillain-Barré or if you have egg allergies, probably you need to skip this vaccine. Local reactions after you get the injection is not an allergy. That's just a reaction. It's very common. Everybody gets it, or at least 80%. And it goes away. You might have flu-like symptoms. You might feel tired. You might have sniffles. That's not an allergy. That's the effect of the vaccine. We know that not all the vaccines are 100% effective, including the influenza. 40% of the patient population do not benefit from it. But it's better than never. You always will have some immune strength towards the infection. And also, another point that you have to remember is in the same family, if you have younger children, in the environment or in the same family, those children need to be vaccinated because they are the ones that will carry the infections to the household. Measles is very contagious disease, and MMR vaccine covers for this. So as a young child, make sure all the younger children in the family have to be vaccinated for this because they will bring it to the house. And this is a community-acquired infection, and it is transferred by the family members. Shingles vaccine. Shingles, there's two kinds of shingles vaccine. The one that is recombinant is Shingrix. It's not made out of the actual virus itself, but the viral particles. So there's no risk of infection development after you give this vaccine to lupus patients or immune compromised patients. However, in parentheses, I should say that this is not very well studied yet in lupus patients in particular. However, we have that vaccine available. The original attenuated herpes zoster vaccine, however, is contraindicated, not studied in lupus, and it may cause infection, particularly in lupus patients and lupus patients on chemotherapy. But because we have this chickenpox development or shingles development after you get the chickenpox vaccine again, and because this is a very severe infection in lupus patients, you have to contact your rheumatologist and discuss when you should be getting and how you should be getting and what medications you should be stopping after you take this medication. Again, when you have a flare-up, how do you know what it is? Is this lupus or is this something else? This is particularly important recently because of COVID-19 infections. COVID-19 has been a puzzle. We don't know who has lupus and who has COVID-19 infection sometimes when they come to the clinic because the symptoms can be very similar. They are overlapping. So I would suggest that everybody in lupus community and lupus patients use this lupus flare plan, and they should seek opinion from their primary practitioners and their rheumatologist immediately after they feel something different. Symptoms that require urgent care that shouldn't wait and should end up going to an urgent clinic or to an emergency room are numbness, especially if there's weakness together with it, difficulty talking, confusion, loss of coordination, vision problems, seizures. These are acute problems. Temperature more than 100.5 with chills is significantly important because that can be seen with viral infections too. New onset chest pains, shortness of breath, pain, swelling, redness of the calf area. It could be a thromboembolic event going on, weakness of an arm or a leg or side of your face, new onset headaches, especially if there is nausea, vomiting, fever, weakness or numbness of the arm, leg, face. These are not taken lightly. New onset severe abdominal pain is also not something that you should take lightly, especially if there's fever, nausea, vomiting, blood in the stool, and very dark schools like asphalt-like. Sudden onset blurred vision, that's also important, especially if it is together with blindness in one eye, redness in the eye, fevers or headaches. So lupus flare plan can be found in www.lupus.org. This has been very well studied and it's really endorsed by the Lupus Foundation of America. So you have to seek opinion from your rheumatologist, communicate immediately. That's the first rule. Blood and urine tests will be necessary. Recognize your flare symptoms. Keep track of your symptoms. If there's a new symptom also, that has to be communicated. And there are things that you can do at home before you go to the hospital. And you have to make sure that you're compliant with your medications that you're taking. And you have to be aware of the triggers that you have been exposed to. And you have to know what requires the urgent care, which is what I mentioned in the previous slide. So what is SARS-CoV-2 infection? Let's take a break here and let's talk about the SARS-CoV-2 infection. SARS-CoV-2 is a member of coronavirus family, which is a group of large envelope non-segmented single-stranded RNA viruses. So these are actually not new infections. These are infections that we got acquainted years ago. So SARS-CoV alpha and MERS, COVID, Beta were the previous infections and pandemics we dealt with, and we actually have an idea of what to do about them. Strangely, when COVID-19 came, we were kind of caught off guard, and but I can tell you that the technology was very advanced, that mRNA vaccines were developed very quickly and tested very quickly and pushed to the market. So spike protein is a common thing for all these viruses. They have a membrane, they have a nucleocapsid, they have an envelope, and the genomic code is RNA. So we take a piece of that RNA and we kind of engineer that for the spike, and then we make an mRNA vaccine. But the most important thing that we realized about SARS-CoV-2 infection or COVID-19 infection is the host defense. Host defense is very important because if you are unable to deal with this infection, if you can't defend your system, then you actually develop terrible, terrible side effects of it: hospitalizations, intubations, lung problems, ARDS. So what happens when the COVID-19 infection enters is your system, like macrophages, recognize that and tells them to the CD4, CD8 T cells, which becomes activated, and they secrete interferon type 1 pro-inflammatory cytokines and all sorts of other chemokine cytokine production and recruitment of these cells that fight against infections and host defense. But I placed here some stars. The stars actually designate the points that in lupus patients, the deficiency. So the macrophage presentation to T cells may not be accurate in lupus patients. The massive release of cytokines, particularly type 1 interferon cytokine, may not be accurate. There is already type 1 activation, and if you have the virus on board, this might just go out of hand. There is no negative feedback loop that affects the CD4, CD8 T cells sometimes in lupus. This activation may not be accurate. CD8 positive T cells are known to be deficient in their function in lupus patients to start with. So they won't be activated, they won't be able to do this, and these may not be able to suppress the others. So there are other mechanisms that lupus patients are not able to defend themselves towards viral infections. So this is very important, particularly for the COVID-19 infection. How did COVID-19 infection emerge? Obviously, we all now know and memorize that it started in December 2019 in Wuhan in China. And then by April, so as you see, very short period, severe hyperinflammatory syndrome started to become an issue in children in US and Spain. And then in about May, so a month after that, or actually weeks after that, initial reports of case series showed manifestations of Kawasaki-like disease. And I can tell you that some of these disease manifestations mimicked lupus patients' manifestations. And then gradually, we started to see more and more of these hyperimmune syndromes, and US got hit by April, May, and June. And by November, we already knew how to deal with the infections, complications, and who needs to be vaccinated. So COVID-19 transmission seems similar in children. It's not any different than in adults. So there is droplets and oral fecal infection risk, and the clustering in the household family, so more crowded families, schools, and closed environments. The density of the virus per unit volume in the air matters. There is lips, eyelids, and nasal cavities that you have this infection through. So this is why we were suggesting shields and masks. Conjunctival mucosa is a mucosa. I mean, it can get any infection in the air. There is no direct evidence of vertical transmission from mother to child when there is pregnancy, which was a good thing to know, or during birth, but you know, after the infant is delivered, obviously they can get it from their environment. Incubation period is approximately 2 to 14 days, so that rule did not change. These are 2020 information, and the rules did not change. But they can be infected 90% of the time, they can be asymptomatic. Age group, average is 7 years, more males than females, but not too much. Most common symptoms in children are the same, cough and fever. These are both very common. There is diarrhea and vomiting as well. And the labs are similar to what we see in adults: low lymphocytes, high neutrophils, LDH, hypertriglycemia, hepatic enzymes are increased, procalcitonin is increased, low complements. They have normal chest X-rays, just like we see in adults, but tomographies of the lungs are better diagnostics. You can find evidence, and they recover in 1 to 2 weeks. I want to show you the right side of the slide here. These are constitutional flu-like symptoms that we see in COVID-19, and nasal congestion, runny nose, loss of taste, smell, sore throat, shortness of breath, diarrhea, nausea, vomiting, stomach ache, tiredness, headache, muscle body aches, poor appetite, poor feeding, especially in babies under 1 year old. Almost 80% of these you also see in a lupus flare-up. So this is very important to communicate to your pediatricians. When you start having constitutional flu-like symptoms all of a sudden, you should contact us and let us assess you and make sure that this is not infection, it's a flare-up, or vice versa. Pathogenesis of SARS-CoV-2 in children seems to be similar with adults, so they have the same immune abnormality going on. And the risk factors for severe pediatric diseases, unfortunately, the younger they are under higher risk, higher percentage of neutrophils in their blood, higher LDH degrees, cell counts are important. And we artificially also suppress these, right? We give medications, and CD4, CD8 positive T cells are diminished even further because of the chemotherapy we give. And progressive pulmonary images is a bad sign. So the risk in lupus patients has been assessed, and I put some of these studies here. New York City, out of 450 patients with lupus, 39% hospitalized, and they all had increased BMI and other comorbidities. And they were mostly older patients than younger kids, so teens. More African American and Hispanic, the ones with the antiphospholipid syndrome or lupus nephritis, and high socioeconomic stress, New York City areas, while the lupus patients were distributed evenly. In the stressed New York City areas, there was more hospitalized patients. So you see all these very morbid conditions and the ethnic background effects. Global Rheumatology Alliance found that this number of hospitalization at 56%. French study showed that almost 100% of all 17 patients enrolled to their study was hospitalized. This is not a rule. 56-39% is not large. And mortality risk is the most important criteria here. It is not increased compared to the regular population. But we still have to be very cautious. So what are the precautions for COVID-19? Avoid high-risk activities such as traveling, indoor gatherings, large gatherings, weddings, funerals. Wear a mask, avoid crowds, again, wash hands, sanitize surfaces. The surface sanitization has been debatable recently. It doesn't seem to be that much important anymore with all the asymptomatic disease going around and most of the population being vaccinated. But still, I think wearing a mask and avoiding crowds and washing hands is going to be important. So let's talk about COVID-19 vaccine in lupus. American College of Rheumatology and Center for Disease Control recommends that all patients with lupus needs to get vaccine. The best way to prevent serious disease and death is still vaccination. What are the current recommendations? So people with autoimmune and inflammatory rheumatic disease, which includes lupus, receive multi-dose mRNA vaccines, Pfizer or Moderna, or if available for their age group, Johnson & Johnson is still in the market. The ACR and CDC also recommend that people with lupus who are moderately or severely immune compromised receive a third dose of an mRNA vaccine at least 28 days after the completion of the first 2 vaccines. So this is a lot different than what normal population is getting. And this is because their immune system is suppressed and they are not able to fight against infections and they are not able to show the same immune reaction to a vaccine as well. This is why CDC and American College of Rheumatology says that they need a third dose for completion of their first set of vaccination. And then they need to get boosters. Everyone over age of 12 received the initial vaccine series, 2 or 3, and then they have to later receive a booster shot. And between that last shot and the booster shot, there has to be at least 5 months because there will still be some immunoglobulins in the circulation. So after the 5 months after the initial series, you need to get another one. People who are over 12, moderately or severely immune compromised, may choose to receive a second booster shot, and that has to be at least 4 months after the first booster. So you're talking about second booster. Now it's 4 months after. And children who have lupus and are moderately to severely immune compromised at this point may need the 5th doses of an mRNA vaccine. We are coming to that, and particularly before school starts, I think it's a good practice. Vaccine side effects in children. So in most cases, these side effects are not dangerous side effects and will go away on their own within a very short time. So you have to kind of discuss circumstances with your physicians if you start seeing any side effect and make sure that it is a side effect or it's not something else that you're dealing with. Some lupus medications will affect how the vaccine works, so you have to coordinate your vaccination together with your rheumatologist, not your PCP. You have to contact your rheumatologist, say that, hey, I'm scheduled to have this vaccine, COVID-19 booster or COVID-19 first series. What should I do next? Because in some cases, particularly for those patients who take immune compromising medications, rituximab, belimumab, azathioprine, MMF, Cellcept, then your doctor will give you special instructions for each medication's use after you got the infection. After you got the vaccine. So there is an American College of Rheumatology COVID-19 vaccine clinical guidance, which you can also download, but it's a little bit complex. And basically, it recommends that people with autoimmune inflammatory rheumatic diseases get the vaccine unless they have an allergy to an ingredient in the vaccine. What are mRNA vaccines? So let's just touch base briefly to that. As far as I know, around 14 million people received this, and then 7,000 were found to have reaction. 4.5 million had only allergic reaction, and there was only 35 vaccine-related death, and those patients were all having some other premorbid problems. 15,000 pregnant women had no problems at all after vaccinations, and no autoimmune patient-related abnormality has been reported so far. These vaccines are immunogenic. They do not carry the infection, so you're not going to get COVID-19 infection when you get an mRNA vaccine. What medications needs to be held? You can continue hydroxychloroquine or plaquenil. It's a very safe medication. You can continue your prednisone if it's less than 20 milligram daily. And anti-cytokine inhibitors, tocilizumab, IL-1RA, anakinra, IL-17, IL-12-23, IL-23, or TNF-alpha inhibitors can be continued according to American College of Rheumatology. They won't interfere with your immunogenic mRNA vaccine reaction. However, we know that you have to hold the JAK kinase inhibitors, tofacitinib, for 1 to 2 weeks. Sorry about the typo here, there's a K. Methotrexate you have to hold for 1 to 2 weeks. Rituximab is very dangerous. You have to give 4 weeks after the second vaccine. You can't just take rituximab and then continue getting vaccines. This is not going to happen. So you have to time rituximab treatment. Make sure that you're vaccinated first and then you get the rituximab. Cellcept MMF you can hold for 1 to 2 weeks, the same as methotrexate and JAK kinase inhibitors, same as cyclosporin and cyclophosphamide, 1 to 2 weeks after. Tylenol you can hold for 24 hours before the vaccine. Belimumab, again 1 to 2 weeks. So these are the ones that you have to be very careful, and individually you have to talk to your pediatricians and also definitely talk to your rheumatologist about any of these disease-modifying agents used after the vaccination or before the vaccination. it's best that you contact them as soon as you know which day you're going to get this vaccine, when you have the schedule, and make a plan. Okay, so you couldn't get the vaccine on time and you got an exposure to COVID-19 infection. What should you do? Luckily, we have now some available medications. So there's a pre-exposure prophylaxis with monoclonal antibodies for vulnerable above 12 years. This is one thing that just emerged over the last 1 year, and I loved it because these are patients that did not get vaccine and they cannot get vaccine because of allergic reactions or other reasons. They might have a very severe infection and a lot of immune compromise condition due to the medication use plus the severe lupus flare-up. Those patients are going to get Evusheld. Evusheld is a passive immunization. So this is again under the emergency use authorization by FDA, and it can help prevent COVID-19 infection if you're exposed to it for up to 6 months in people who haven't been exposed to the virus or exposed to the virus. So this is pretty good. I mean, it's best that you get this medication before the exposure happens, obviously. The drug is recommended for certain adults and children, for children who are beyond 12 years of age and weigh at least 88 pounds. So you have to be close to adult size in this case. Evusheld consists of 2 shots, 2 injections, and they are done the same day, and they are repeated every 6 months. So this is a good preventative approach, and it's as good as vaccine. You just have to get it every 6 months, and this is in case you cannot get the vaccine, and you need to discuss the necessity of this with your physician before you get it. COVID-19 infection treatment in pediatrics has been also problematic because FDA did not approve anything for adults for a long time, and pediatrics was also affected from that. However, we now have post-exposure prophylaxis and treatment for the active disease. We have monoclonal antibody treatment for patients above 12 years of age who has high risk during infection. So they got infection and they are under high risk, then we can give the combination of this, and this. There's also sotrovimab, which recently pushed to the market that you can use alone. So these are monoclonal antibodies. They are infusions. As soon as you have the infection, as soon as you have a positive test result, you should communicate immediately to your rheumatologist or an infectious disease professional as soon as possible, and they will arrange this because I think there's a short period, approximately 5 to 7 days before you can get these medications IV. If it's too late, you're not going to be eligible to get these. There's also antiviral medications for above 12 years of age, and these are nitramel, I'm not going to be able to pronounce it well, but nirmatrelvir and ritonavir, and beyond 28 days, remdesivir can be used. Oxygen therapy, glucocorticosteroids together with tocilizumab, they have still trials ongoing, but they can be used as emergency. Obviously, we have some other supportive care medications such as low molecular weight heparin, vitamin D, and antibiotics for superinfections, fever control, and hydration. And again, mortality rate for hospitalized children was very low for COVID-19, 0.18%. So best precautions are, again, medication compliance, communication with your rheumatology provider, communications with your PCP, communications with your pharmacist. And this ends my talk. I would like to thank you for listening to me and thank the Lupus Foundation of America for giving me the opportunity to reach out to you and discuss these. And I'm happy to answer any questions with the wolf in the background.
Thank you so much, Doctor. I feel this was a lot of information and good information, and hopefully our parents out there are grasping it. I feel like I need to watch it one more time to really digest this information, and we are recording. So we will be able to share that a little later down the line with our group here, because I know I want to rewatch this and questions are coming in. I'm actually just going to grab the slide from you. So just give me 1 second here. And very good. So we're going to open up the comment section for questions, and I have seen a few rolling in. So if you could just use the comment section to ask any questions for Dr. Bukulmez. But one that's popping up here, and I apologize, it's very small on my screen, but what infection should I be most concerned about? Is one more worse than the other? Is there something parents should be worried about for their kids to, for their child to be coming in contact with, I think is what we're asking here.
Okay. I'm a pediatrician, so when it is a pediatric case, any infection is dangerous to me because I just don't have the heart to let things happen to them. So, but the most dangerous ones, obviously, the unknown ones that we don't know how to treat, for example, COVID-19. You know, when your children is going to be exposed or is exposed at school settings or in gym or in a party, birthday party, then that seems to be the most dangerous one now, because as a lupus patient, probably the immune compromised status is bad, and he or she already has some medications on board that will avoid him to fight against this infection. And when the infection happens again, you should contact your rheumatologist as soon as possible. What are the others? Obviously, pneumonia is a dangerous one, and it's in the community. Community-acquired pneumonia can be really dangerous when your body is not able to um, defend itself. So these are bacterial infections or mycobacterial infections or mycoplasma infections. It's sometimes like a walking pneumonia. Most kids have it. They cough a little bit and they do well, but in an immune compromised patient, it can be making them hypoxic immediately. Some influenza, flu, sniffles, strep infections, these are much more easy medications, easy diseases to tackle. And for strep, we have medications that helps in over 24 hours. So this is why instead of trying to judge which infections you should be concerned about the most, I think as soon as your child shows any symptoms, communicate to your PCP first. And then if the PCP is not able to tackle this, definitely they will interact with us, with the rheumatologist, and will make a plan for treatment. I wouldn't take any infection lightly, personally.
Thank you for having a big heart too, so we don't want to see our kids get any infections. But great rule of thumb, reach out to your general primary first, and they'll kind of help make that decision if it's time to move forward and see your rheumatologist. So another question coming here. What causes me to get more infections than my friends?
Okay, so I think this is coming from a patient. So this is an excellent question, and needs a little education about your immune system. And I don't know what kind of lupus you have. If you have systemic lupus that is affecting your entire systems, this means some of your immune cells are not doing their jobs well. They are doing some extraordinary abnormal functions that causes lupus, but when it comes to fight against infections, they are not very, very well charged. You have the immune system intact, but they are not working well for you. Instead, they are busy causing lupus for you. So when this is ongoing, when you get an infection, your body is busy doing something else, is not going to be able to respond to that virus, and you will get sick and sick while your body is trying to generate lupus. On top of that, to suppress that lupus activity from your abnormally functioning immune cells, we are going to give you medications, and you are probably on those medications already, and you cannot really act against the infection that enters your body. This is why you can get more dangerous infections as compared to your classmates, because your body is just not able to fight against it. And because of this, you are the one who needs to mask, you are the one who needs to wash hands all the time and stay away from kids who are coughing and having sniffles, and just be more aware of your environment.
Being more
And I can
mindful.
tell you that, this is not such a bad news. I can tell you that most of my patients who are on immune compromising medications do not develop flu or other infections as often as their classmates. And you know why? This is because they're aware and they protect themselves by washing and masking and staying away from sick people. So this is not bad news.
And that's just general good advice, right? Wash your hands, wear your mask, and cover up there. So yeah. Okay, let's see what else I got. And I apologize, the text is small for me. If I don't take any immune suppressing medications, and am I still susceptible to having lupus alone? Susceptible by having lupus alone.
So if you have a lupus diagnosis already, you might be in remission, and because of this, you may not be taking your medications, which is all right. But we know that by nature, your body is able to develop lupus. So something caused this in the past. And if you get another trigger, like, I don't know, sunburn or some antibiotic or some viral infection, obviously you might regenerate that autoimmunity again and have a lupus flare. So that you have a baseline susceptibility for lupus. And you have to think about that always. Keep it in your mind and make sure you protect yourself from people who has infections, and make sure you put a lot of sunblock lotions or stay under the shades or use the antibiotics very carefully or hormonal therapies carefully, and communicate to your pediatricians who will be giving you any medication well.
So this is a question just talking about remission. How does a patient know when they're in remission? And I'd like to just make a comment about the flare plan you talked about. But how does a patient know when they're in remission?
So this is something that they have to discuss with their rheumatologist also. We have criteria that we use for remission. In general, the rule for remission is disease-free and drug-free period for 6 months. This is a golden rule for any disease, not only for lupus, especially when you talk about chronic autoimmune diseases. So if you're not in need of taking any medication for 6 months and you don't have any clinical evidence or laboratory evidence, which has to be done by your rheumatologist, and your rheumatologist needs to examine you really well, and if you're feeling all right, then you're in remission.
So your rheumatologist will tell you. It's a discussion with your doctor. And so that kind of brings me to, thank you so much for highlighting the lupus flare plan on lupus.org. Our patient navigators for our chapter, if you work with us, we actually work through those flare plans with the parents and patients that come in contact with us. So, you could download that form, come up with your flare plan, write those questions down, the answers to your questions down, excuse me, and talk with that to your rheumatologist. I think it's really important, and I'm so glad you brought that up. Because I think it is good to make a plan, talk with your physician, and so you just know what to expect. A question coming in here is, can I get an infection from my dog or cat?
Okay, well, there are some infections that dogs, cats, and humans share. Obviously, you can get those. But not to the level of COVID-19 infection. Probably it's going to be something mild and can be taken care easily. And usually, pets that we live with are not the ones that will give you infections. They are usually in your same household environment. They don't go to a birthday party or to a funeral or a wedding. They are home with you and you just take them out. So they probably don't carry infections from around them to you. So I think they are safe.
Parties and large gatherings to pick up viruses. So infection. Another question here is, I've had cellulitis twice. Is this from my lupus?
Okay, could be. It's hard to tell if you have an active lupus and if you're on some chemotherapy drugs like MMF or azathioprine, then it might be putting you to a vulnerable condition. And there is community-acquired methicillin-resistant staph aureus infections, which is very common. And I see a lot of lupus patients developing that and keeping on getting that if there's a little bit of a wound. So it might be because you're a little bit more vulnerable than the regular population. It's possible.
One that's just coming in online, it says, I'm a little confused. I had the J&J twice. I have lupus and just got over COVID. Which one do I get next?
That's the infectious disease question. Depends on how long ago you got the J&J. And they say that you can now switch kinds. If J&J was long ago, I mean 5 or 6 months ago, and your COVID infection is also improved, I think you can switch to Pfizer or Moderna. There's no rule about this, and this is a question that is quite unknown still. So there has to be studies done to make sure that we are assured that you can do this and you can do that and then switch to another vaccine. To me, if the Johnson & Johnson effect has gone and you recovered from your recent COVID infection, you can get any of these vaccines again. Also remember, there is a new vaccine, which I didn't mention too much because it's not really approved for use of pediatric cases, which is the Novavax, which is a old-fashioned type of vaccine. That's also coming up, and the situation will be even more complex when that's also on board for pediatric use.
Okay. Another one online here is, does Plaquenil act as a buffer to COVID?
Yeah, so that's a very good question. There was a lot of debate about use of Plaquenil after exposure during acute COVID infection, and then there was a lot of use of Plaquenil by regular public, not only by lupus patients, and we started to be careful with the prescriptions, and we started to question why these people need the Plaquenil, just because the initial studies showed that Plaquenil is not effective against lupus, I'm sorry, it's not against COVID-19 at all. It's not preventing the infection itself. It's not treating the infection itself. Does it help lupus patients? It probably helps in a very strange way, because your lupus is causing your cells not to function well, and Plaquenil is trying to make them function better. So use of Plaquenil when you have lupus might make your ability to fight with COVID-19 infection better. This is not the same as in normal population who doesn't have that cellular problems. But you have that cellular problem, and Plaquenil will fix them to a certain level, and you will be almost even as another normal person in the society when you're using Plaquenil. Plaquenil is a very good medication. It actually prevents lots of organ damage and suppresses all that vascular inflammation, the skin rashes. It's been proven to be very useful for prevention of lupus nephritis, glomerulosclerosis, liver damage. So I think it's a good medication, and it probably helps you fight against infections, not only COVID, when you're using it. I hope that answered your question.
Yeah, it's very important to be taking your medications, talking with your physician. One more question here, Dr. Bukulmez, and then perhaps there's a bit more time at the end. We can ask a couple more because I do see quite a few coming through. But this one is the new protein-based vaccine available for children yet? Is this safe? And is that what you were mentioning before?
Yes. I don't have any information about pediatric use yet. I'm expecting that will come in the next few months, because they first want to do is try it in adults and then market it for adults, check the post-marketing status of vaccine, whether there is any unexpected and unfounded abnormalities in the regular public, and then decide to give FDA approval for pediatric use.
So we need more information. Yes.
A
And
little more time.
a little bit more time. That was the Novavax vaccine you were speaking of?
I think
What
it's
was
called Novavax.
Novavax? Okay. Thank you for answering that. And I am so sorry if I did not get to your questions, but perhaps if there's time at the end of this session, or if there's anything pressing that I was not able to cover, if you could email me, and I'm sure I could email that to Dr. Bukulmez, and maybe she could answer it for us at a later time if we don't have time at the end. And I do apologize, but thank you so much. This was a great presentation. And I see, you know, we have quite a few people on here and great questions that they presented. So I'm very appreciative. And we're going to move
Thank you
on.
all.
Yes, thank you. We're going to move on to our next speaker here. So trying to stick to time. And if you could just bear with me for one moment while I switch my slides. There we go. I can work it. Sometimes it's a little hard for me. But okay. Hello, Courtney.
Hey, Leslie.
Hi. Our final presenter is Courtney Mitchell, BSN, MSN, CFNP, and she is a patient engagement liaison with GSK. She has extensive experience working with the lupus community and is passionate to help empower and advocate the lupus community. We have the pleasure of having Courtney present with us today about teens and lupus. And I thank you so much, Courtney. Let me just give you the virtual floor, and sometimes all these little functionalities get in my way, but just give me one moment and I shall give you control. And thank you again, Courtney. There you go. Thanks for joining us.
Yes. Okay, Leslie, we're going to hold our mouths right and hope you can see just my teens living with lupus slide. Is that good?
And can you toggle in between? Is that working for us?
Yeah, trying to make sure I can advance my slide.
Yeah. Can you go up?
Yes.
One? There we go. Beautiful. Thank you.
All right, so things are cooking. Things are going good so far, so that's great. Yeah, I'm really excited to be here with you today. If you were on the previous pediatric symposium event, I spoke at it as well, so welcome back if you were on there again. And like Leslie said, I am a patient engagement liaison with GSK and a super proud sponsor of today's presentations. So just really excited to be here. I'm very passionate about lupus and lupus nephritis patients. I practiced as a nurse practitioner in rheumatology for 10 years and then have been continuing to support lupus patients at GSK for the last 7 years. So a total of 17 years of taking care of lupus patients and supporting lupus patients. So today I'm going to talk about teens living with lupus and you know, how really that looks different than adults living with lupus, right? Because there's definitely some differences, definitely some similarities, but you know, definitely as a teen or a child, it definitely affects you in a different way, obviously, than you know, having lupus during adulthood. So interestingly, teens and about 20 million children and teens actually suffer from a chronic health condition. Okay, so being chronic means that it can't be cured, but it can be controlled, but the symptoms usually last longer than 3 months, okay? And lupus is one of those many chronic illnesses. So really in a nutshell, 6% of people aged 10 to 18 suffer from some type of chronic disease. So like I said, managing a chronic disease as a teen is definitely different, or you know, as a child is definitely different than suffering from a chronic disease as an adult. So actually, you know, how many people get lupus as a child? So 15 to 20% of patients with lupus are diagnosed as children, typically, you know, younger than age 16, okay? And 80% of those children diagnosed with lupus are females. Childhood onset of lupus is considered very rare. But like I said, most common in female children that are Asian, African American, Hispanic, and Native American descents. So how can lupus symptoms impact life? I know that Dr. Bukulmez touched on some specific symptoms of lupus. So as you remember, she talked about the rash, the hair loss, pain, joint swelling. So those are just a few of the symptoms that can occur with children with lupus. Also, children may also have, and adults as well, may have side effects of medications that can cause weight gain, acne, stretch marks, and things like that, and things that can definitely impact your self-image and your confidence, okay? So anytime you have hair loss or a rash on your face, teens or children, just as adults, can definitely become self-conscious of that. Nonetheless, kids and teens with lupus are more likely to find social support, and to feel more empowered. I think sometimes, children sometimes are more resilient than adults, interestingly. So childhood lupus can affect many body parts, and like I said, Dr. Bukulmez touched on these, but definitely the skin, muscles and bones. Lupus can actually cause inflammation of the kidneys, leading to lupus nephritis, can cause inflammation around the heart, lungs, can cause anemias as well as problems with the central nervous system. And this is not a full list of body parts that may be affected by lupus, but just probably the most common, to name a few. So impacts of being diagnosed at a young age. So interestingly, it's a greater risk of more severe lupus when you are diagnosed at a younger age. So teens will experience more active lupus symptoms in their lifetime. Also, if we talk about inflammation, Dr. Bukulmez talked about the immune system and how it attacks itself, and all of that craziness going on in your immune system, leading to obviously inflammation. So it can cause inflammation of the kidneys, as I just mentioned before. So 50 to 75% of children with lupus will develop kidney involvement, and that's really, to me, a high number. Most often in the first 2 years after diagnosis. So you really need to be aware, and this is where I really want to emphasize too, that you make sure that you keep your appointments with your rheumatologist, so that your rheumatologist can do labs and urine analysis to look for these types of symptoms, because these are invisible symptoms, okay? So it's definitely important that you keep those appointments. Also, steroid-associated damage. Steroids at high doses for long periods of time can be detrimental, okay? They can cause other issues within your body. So more than 90% of children with lupus will receive corticosteroids to help obviously manage their symptoms, okay? So the earlier your disease is diagnosed and you begin treatment, can actually minimize the risk of organ damage. So definitely important to go to those doctor's appointments and have your rheumatologist see you, when they say they need to see you, okay? So mental impacts of lupus, as I said, I talked about it a minute ago, self-image disturbances, your confidence can, be impacted by the visible signs of lupus, okay? And then obviously you don't feel well, so that impacts you as well. So growing up with lupus can definitely affect your emotions and mental health. And Dr. Bukulmez, I'm sorry, I could get out, mentioned, that about how emotional stress can cause a flare. And she touched on physical and the others, but definitely emotional stress can be very taxing on your system and lead to flares. So if you're experiencing any anxiety or depression, make sure to talk to your doctor and think about seeing a counselor, and see who your healthcare team recommends. I honestly believe everybody needs a counselor, okay? But definitely just to help navigate through the journey of having a chronic disease. It's very, very difficult. So definitely think about seeing a counselor. And if you're feeling alone, isolated, look for support from family and friends. You may be able to find, have a family member that actually suffers from lupus or a close friend. You may be able to find a support group. Definitely, look into the LFA groups, see if there's anybody that you can connect with. And I think that having just a tribe around you that you can talk to that can understand what you're going through. Be sure to take your medicines on the correct day, the correct dose, the correct schedule. Even if you're busy with school and activities, just make sure that you are being compliant. And that just means doing what you're supposed to do when you're supposed to do it. If it means writing down on a calendar when to take your medicines or setting an alarm on your phone, but whatever you need to do to make sure that you take your medicines the way you're supposed to. I also too want to advise you, if you have a side effect to the medication and you or have an issue, make sure that you talk to your rheumatologist so he or she can determine whether you need to stop that medication, take another medication, or what you need to do. But don't just stop a medication without notifying your rheumatologist. If you're feeling hesitant about going to school, sharing experience with friends so that they can understand what you're going through. And then I also too want to talk, recommend that you talk to your counselor at school. Most schools have counselors there just so that they can know what you're going through. And then if you're nervous about having a flare or not feeling well at school, or if you're missing school, make sure that you have a plan for making that missed homework. But I think that collaborating with your counselor at school, just so that they will know what you're going through, they can help navigate through, the complication of missing school and that kind of thing. And I think too that just helps cut down on the embarrassment of missing school and things like that. But just know that you have a team of people that care about you and love you and that can help navigate through the process. Being proactive is so important. Really learn as much as you can about lupus. I know that at a young age, if you're diagnosed with lupus, it's really hard. But really learn as much as you can that you can get your hands on. Be honest with others. Be open. Have good conversations, especially your parents and your loved ones, because they are a very strong support group for you. Ask help from others. Like I said, have conversation with a counselor at school. You might need help from your friends carrying books on certain days or things like that, but just don't be afraid to ask for help. And understand your limitations. Don't say yes to too many activities. I think as females, we do that, or males too, do that. We just say yes to everything. But don't do too much on yours. That puts too much on yourself. I mean, you know your limits and what you can and cannot do. Maintain a healthy lifestyle. Make sure that you get enough sleep. Try to do what you can to cut down on your stress level. Make sure that you eat well, eat a good, healthy, balanced diet, okay? Also, I recommend that you keep track of your symptoms. You may have new symptoms that occur before, since your last visit, or you might have a symptom that's popped back up again, but definitely jot those symptoms down so that when you go see your rheumatologist the next time, you can share that with he or she and let them know what's going on, okay? Again, be active with your appointments. I know there's times, when you have lupus that you're doing really well, and sometimes you might think, I don't really need to go see my rheumatologist. Well, you do. So make sure that you keep up with those appointments. There's labs that need to be done because of medications that you're on, and then also checking disease activity. So definitely for your safety, always keep those appointments, okay? Keep track of your treatment schedule. Yet again, keep track of when you need to take your medications, take them on time and the correct dose. And then also, very important, you avoid alcohol and recreational drugs. So this is just a touch on caregivers, okay? So caregiver stress is a real thing. It's definitely emotionally taxing, especially if you're a parent of a child that has lupus, especially in the very beginning as you're learning this and you are trying to learn as much as you can about lupus and you're caring for your child. That is very stressful. So just some helpful hints here. Help your child keep track of symptoms. Jot things down as well, or encourage your child, especially if you have a teenager, just to be a really active part of that. Jotting symptoms down. Maybe if you have a child that is interested in health journaling, that's another way to just kind of get rid of and write things down and be, just a way to express yourself that helps, I think, from a mental standpoint. Also, make sure that your child or teen is maintaining healthy nutrition, getting adequate rest and exercise, so help manage that. And then definitely practicing sun safety, making sure that you make sure your child is wearing sunscreen, reapplying sunscreen, between 8 and 4 or 10 a.m. and 4 p.m. during the day, or the days that the ultraviolet rays are the greatest. So make sure that your child is covering those arms and legs, because those can definitely initiate flares. Again, encourage your child or teen to take medications when they are supposed to. So you may want to, set reminders as well, and to remind he or she to take their medications. Also, just keep an eye on emotional health. Just, open up communication, talk to your child or teen, make sure that they know that they can talk about it with you, okay? That's so important. And then take care of yourself. Caregiver stress is a very real thing. So make sure you're taking time for yourself, exercise, do fun stuff, escape in a book, whatever you need to do to help with your stress level as well. And then I can't, encourage enough as well. I've said make sure that your child or teen goes to their appointments, but as a caregiver, definitely want to make sure that they are there for those appointments. It's very, very important. So that concludes, my piece on teens living with lupus. So here I want to share these QR codes where you can have access to free resources at your fingertips. Like I said, it's important that your teen or child learn as much about lupus as possible. And I mentioned too about symptom tracking. So that first QR code is a symptom tracking kit. So if you want to pull out your phones and get your cameras out and hover over that, it'll open up into our usandlupus.com website. So go there. Make sure that once you put your email address in, you scroll down a little bit farther and hit submit, and that way we can make sure to capture that information. There's also some tips on talking about lupus and some tips on living with lupus, and then some information about caregiver resources. So all of that, like I said, is free through GSK at our usandlupus.com site. I also want to invite you to our gskplacehub.com site where you can register for free webinars with additional lupus information. And so that is gskplacehub.com. All right, so I'm going to turn it over back to Leslie, see if there's any questions, and thank you for having me today, and I hope that you all got some takeaways from the presentation.
Awesome, Courtney, thank you so much. I'm going to let these QR codes and everything kind of hang out for just a second so everyone can grab them. Taking your phone, you put your camera up, and it should be able to read that barcode to take you to the links. So that's wonderful. And, I wanted to mention that last part you just mentioned there. Our caregivers, our parents out there really do take that piece of advice, Courtney, and take time for yourself, what you're saying. I think that's so important as well for parents and patients. Okay, I'm going to grab the screen. If you guys can start using the comment section, and I do have a few questions popping up there. Let me grab the screen. And if you use the comments section to the side, you should be able to ask some questions. And I do apologize, it's a little small, and I saw a couple more come in for Dr. Bukulmez, but we have a question here. It says, can I go to college, and how will it be different? Maybe someone's getting ready, a senior we have out there, but how can I? Yeah, actually, you want to take it, Courtney? Can you go to college? Absolutely.
Absolutely. I think the more that you can lead a normal life, the better. Yet again, there's resources for anyone. I have, it's kind of for instance, I have a son that has ADD, and he's never really wanted anybody to know that. And he, has, there have been times where he's taken medication and then he's stopped taking it because he hates the way it makes him feel. Anyway, long story short, he just went to Ole Miss, and I encouraged him to apply for disability services so that he can go if he feels that he needs extra time on his test. So there are accommodations that can be made. So I definitely, wherever you go to college, I say make sure that you collaborate and ask questions of what type of support you can have. What if I have a flare? There's some great questions to ask those people, but I definitely encourage you to lead as normal of a life as you can certainly lead. And then also to have a conversation with your rheumatologist. I always say that, Dr. Bukulmez and I keep saying the same thing, but this is, you always want to rely on your rheumatologist and healthcare team to ask questions, and they can give you a gauge too of like, how active is your disease, or how well controlled are you, and I think they can offer really good advice. And then also too with counseling, have that conversation if you have a counselor. But just some recommendations that there's always people out there that can support you. But a great place to start is with your rheumatologist, and they can get you to those areas that you need.
I would like to add to those a little more. Courtney really framed it really well. I mean, this is an important question, and it's very important that you communicate and use all the resources, obviously. To me, one of the most stressing things in teens' life is this college transition, because they leave their secure environment, go to somewhere else. They don't have their old friends anymore. So the support system completely disappears suddenly. So that's the shocking emotional stress. Plus, college is not as easy as high school. Very demanding workload, very demanding projects and deadlines. So that gives an additional stress. Plus, this is the time that you meet new people and they don't know about you, and there is going to be a lot of explanation as to what you're doing and what's your disease. And that's another stress. So peer stress, workload, new environment, loss of the secure environment you have. On top of that, they lose their communication with their rheumatologist because they're not in the same town anymore, which bothers me the most. So what I do in my practice usually is make sure I bring them to my clinic when they have breaks, like Thanksgiving break, spring break, winter break, summer break. I touch base with them. This is almost 3 to 4 months. Every 3 to 4 months, at least I have a telehealth visit or in-person visit if they are visiting the family, so that I just go through everything, assure that they are supported, I'm not leaving them. And what I do before they leave for college is to contact the rheumatologist that I know in that city and make sure that I transfer the records to them, make sure what's going on with that patient and all the medications, link them with that, local rheumatologist. Usually this is going to be now an adult rheumatologist because I'm a pediatric. That the transition from pediatric to adult rheumatologist is even by itself a big deal. But at least I would like to keep the communication going, and I want my presence in there occasionally when they come to town. So from disease perspective, from their disease security, being able to treat the disease continuously and measure the flare-ups, I'm there. So you need to kind of communicate to your rheumatologist before you leave for college and have something similar set up like this, so that at the least the disease is under control with all these shocking emotional events. It's fun to go to college. It's an achievement. It's a beautiful thing. I wish every kid goes to college, but at the same time, it's a little bit emotionally stressful. So we have to kind of use what Courtney said, all those resources, counselors, everybody around us, and then some.
Yeah, so really identifying who you can reach out to and definitely encourage going to college. It can be a scary time for anyone going.
For anyone.
But don't forget about your rheumatologist before you go. I think that's what Dr. Bukulmez is saying. Tell them. So yes, that is great. And actually, our fourth session, we'll be talking with Dr. Stacy Ardoin, who will be talking about the transition from peds to adult. And so that'll be a great one. And then we'll also have a patient come join us for that final session, talking about how she transitioned, who she reached out to, how was she successful in her first year of college, and things like that. So definitely jump on board, and we can connect with another patient to see how they transitioned. So we'll be doing that for the final one. But thank you both. There's still more questions coming through, and let me just see. Do either of you have what's the best way to explain lupus to my friends? Do we have a simple way of saying, like, what is lupus to my friends?
To me, it's not a simple question. Obviously, lupus is very complex. Even the physicians don't understand all of it yet. But you can simply say that you have a chronic immune compromising condition, and you have to be taking medications, but you will have a normal life otherwise. You just have to be very cautious with contaminations and infections.
We'll tell our friends to wash their hands and mask up too. We'll tell everyone to keep you safe. Okay, some more questions here. Are symptoms different in teens with lupus?
Lupus has a very wide variety of presentation. As if you can remember in the beginning of my talk, I mentioned 4 different kinds. Obviously, dependent on which kind you're affected from, things will be presenting itself different. Some people will just have mental illnesses, brain fogs, headaches, other issues with their eyes. Some people will have just limited skin disease. Some people will have some kidney issues, so swelling, blood pressure problems, heart issues, or liver issues. So there's a huge spectrum of symptoms in the beginning, and it's unknown which one will be the most important and which one has to be the one that presents in the beginning and what follows next. This is a huge spectrum of presentations, and it's very individual, dependent on your genetic background, dependent on your triggers. Things will be presenting different. If you have a genetic background to develop lupus after you get UV lights, this will present itself with sunburn like rashes on your skin. If you have predisposition to develop arthritis, then you might start having morning stiffness, pain in your hands or your ankles, your feet, or generalized fatigue and generalized stiffness too. Generalized fatigue seems to be the most common presentation, but I can tell you in our society, especially teens, are very tired. They have extracurricular activities, sports, they study a lot, they have homeworks to finish, they don't sleep well, and the weekends are crazy. They have to do a lot of other tasks. So they are chronically tired anyway. And when they get more tired, they don't know whether this is secondary to lupus or their lifestyle. But that seems to be like the most common presentation overall in teens.
I have a concerned parent here. It says, I find find it hard that I find that my teen has a hard time managing keeping up with activities and schoolwork. Do you have any advice for me to help them?
One thing that we can help with the schoolwork is, first of all, we can communicate to the school. We can write a school letter and in detail explain the abilities and expectations from this person's schedule. I mean, we can lighten up a little bit and get support from the school systems to aid them with these. I mean, if there's a huge headache, that person is not going to be able to get the best out of it. Then the school needs to know and needs to help them. So the best way, again, is to contact rheumatologists and see what they can do to provide a letter. That's a start. At home, obviously, catching up with the homeworks, finishing the projects on the deadlines given is a whole different scenario that's beyond school. And as a parent, I think it's challenging because besides your own responsibilities at work and at home that you have to do, you have to kind of tackle this with your teen. So you have to have a very good relationship with your child and kind of be on board when they are tired, when they can't do, or when they are frustrated with their schoolwork. Just be there and say that, well, I'm here. Let me help you. What is it about? Or can we get help from someone else? I have families who are looking for tutors 2-3 times a week that comes to home to watch out for those deficiencies because the parents are too busy. That's the way of doing it, but not everyone can be able to find a good tutor. I mean, myself, I couldn't find one yet. So it's not easy, but you can reach out to the older family members who are retired, who can be on board for those tasks, type of thing. So you're going to have to kind of use your social abilities and network and bring on board some help that the teen can communicate easily with so that you can support at home, or you just have to be there and jump in when there's a need.
Yeah, a tutor is a great suggestion, and maybe the school has, a resource that they can reach out to connect your child with, extra help, getting extra help at school. A tutor is a great suggestion. All right, well, we are running a bit over schedule, and that's okay because we had a lot of great dialogue, and I really appreciate Courtney and Dr. Bukulmez for coming with us today and having a really great conversation. And I think this is where it really starts, is getting the family together and having the conversation. Maybe patients feel intimidated to talk to their doctors, but we can see here we're just sitting with each other chatting and talking with each other. And I think it's so important to be able to know who to identify, that you have a team of people at the Lupus Foundation, at your doctor's office, at your school that is willing to help and show you how to live well with a chronic illness. So I would like to take just a moment again to thank our generous sponsor. Funding for this program was made possible by GSK and Us and Lupus. And again, we would not be able to host important programs like this without their sponsorship. So thank you so much. And we do have a third session coming up for navigating the pediatric lupus journey. It's next Saturday. It's August 27th. I created a little QR code there too. You can hover over it and register for the next session. Or if you've already registered for the last, all four, you'll be getting notices about that. But we will be joined with Cleveland Clinic physician, Dr. Elizabeth Brooks, and she'll be talking about working with your doctor. So that'll be a great topic of discussion. And then we'll have a licensed social worker as well, talking about managing lupus. And I'm going to ask Courtney to come join us again for that third session. So please be sure to join us next week again. And that really just brings us to the close of our second session here, Navigating the Pediatric Lupus Journey. Thank you to everyone for joining. We are tremendously grateful to this expert panel for joining us today and to help create a path to empowerment. Please remember to complete the evaluation. One will be sent to you 1 hour after this program, or after you exit out of this program, a pop-up should appear to take our evaluation. Remember, each session attended, registered, attended, and an evaluation submitted, the pediatric patient will earn a reward. A $5 Target e-gift card will be awarded for each session at the completion of the webinar series. Any rewards earned will be distributed to the pediatric patient. After the completion of all 4 sessions, the pediatric patient will receive an electronic gift card and a certificate of completion. But please be sure to check back periodically to our chapter website, lupusgreaterohio.org, or sign up for our emails to keep up to date with information, services, and programming, fundraising opportunities. We have a walk coming up pretty soon here. You can also call 1-888-NO-LUPUS to get more information, or we can connect you with a patient navigator, a local patient navigator in your region of the state, that wherever you're at in Ohio. And finally, we are committed to providing you with the most accurate, up-to-date information as it becomes available. And that brings us to a close, everyone. Be safe and continue to strive to find optimal health, and we will see you soon. And I want to thank you again, Courtney. I want to thank you again, Dr. Bukulmez, for joining us. I thoroughly enjoyed the presentations very much, and
Thank you.
Back here.
Enjoyed it.
Enjoyed it as well. Have a good weekend, everybody.
Yes, thank you. Enjoy. Take care. Bye-bye.